If you are taking proton pump inhibitor or PPI, did you know that this medication that you rely on might be causing nutrient deficiencies without you even realizing it? You need to hear this. Hi everyone, I'm Maria Zamora Crosby. I'm a doctor of nursing practice and functional medicine and primary care provider at Lovingkindness Wellness Practice in Shelburne, Vermont. Welcome to our channel. Today, we're diving into the world of acid reflux. Specifically, what happens when you take those little pills called proton pump inhibitors or PPI on a long-term basis without proper indication. PPI can be obtained without prescription. You can buy them over the counter. But taking them long-term without a valid need and a medical supervision can lead to some unexpected and undesirable side effects. Let's start with H. pylori. H. pylori is a bacteria that secretes an enzyme called urease. Urease breaks down urea into ammonia and carbon dioxide. The ammonia then neutralizes stomach acid, helping this bacteria H. pylori survive and thrive in your stomach. Talk about master of disguise. And guess what? About 50% of the world's population, that's like 3 billion people, have H. pylori chilling in their stomach right now. But here's the kicker. 15 to 75% of those people might end up with irritable bowel syndrome or IBS, or small intestinal bacterial overgrowth, also known as SIBO. Irritable bowel syndrome is a common gastrointestinal disorder characterized by chronic abdominal pain, bloating, and altered habits such as diarrhea, constipation, or a mix of both. The exact cause of IBS is unknown, but it is believed to involve a combination of gut-brain interactions, motility disturbances, and heightened pain sensitivity. On the other hand, small intestinal bacterial overgrowth or SIBO occurs when excessive bacteria accumulate in the small intestine, which normally has fewer bacteria compared to the colon. Then this overgrowth can interfere with nutrient absorption and produce symptoms like bloating, diarrhea, abdominal pain, and malnutrition. I have a separate video for that. SIBO is often associated with underlying conditions that affect gut motility and anatomy, such as IBS, celiac disease, and certain surgeries. Now, let's talk about the G cell. G cells release a hormone called gastrin. Gastrin's job is to zoom around in your bloodstream and tell your stomach to produce acid. But too much gastrin can make the valve at the top of your stomach, the lower esophageal sphincter, relax a bit too much. It is like leaving the lid off your soda bottle, hence acid in the stomach leaks out. This relaxation can lead to acid reflux or GERD, that burning feeling in your chest that sometimes could feel like you are having a heart attack, which is why it is called heartburn. Then comes the proton pump inhibitor, the PPI. These pills are like secret agents that reduce the stomach acid production by up to 99%. Sounds great for stopping heartburn, right? But here's the plot twist. They can also mess with your digestion big time. When your stomach is not making enough acid, your body has trouble absorbing some important nutrients. Let's break it down. First up, vitamin B12. Because PPIs block the acid production in your stomach, it makes it harder for your body to absorb vitamin B12. According to a systematic review and meta-analysis, patients receiving PPIs for more than 2 years were at a 65% increased risk of vitamin B12 deficiency. It was also noted that the use of 1.5 pills or more per day of PPI was also associated with increased risk of vitamin B12 deficiency. This is due to the fact that decreased gastric acid does not facilitate absorption of vitamin B12 in the terminal ileum of our digestive tract. Another deficiency is magnesium. PPI can interfere with the body's ability to absorb magnesium through the gut, leading to a risk of hypomagnesemia, which has been supported by multiple meta-analyses. Next, vitamin C. Lower stomach acid means less vitamin C in its active form, potentially decreasing its absorption and availability in the body. Iron. Stomach acid is essential for converting dietary iron into the form that can be absorbed. But without enough stomach acid and with low vitamin C, your body cannot absorb iron properly, which can lead to anemia. And finally, calcium. Calcium needs a certain pH to be absorbed, and PPIs mess with that balance, which can impair calcium absorption and increase the risk of bone fractures and osteoporosis over time. Here are some quick tummy tips. First, if you have been taking PPIs for many years, don't stop them immediately. Stopping PPI suddenly is generally not recommended and should be done only under the guidance of your doctor. And here's why. Gradually reducing the dose of PPIs rather than stopping abruptly can help minimize rebound symptoms. This is because the rebound effect of proton pump inhibitors can lead to an overproduction of gastric acid, causing symptoms of acid reflux and heartburn to return often more intensely than before when you started the medication. It's like returning with a vengeance. This is because the body compensates for the reduced acid levels while taking PPI by increasing the number of acid-producing cells. But when you stop taking the PPI, these cells produce an excessive acid output. This phenomenon is known as rebound acid hypersecretion. This underscores the importance of gradually tapering off PPIs rather than stopping them abruptly, and this process should be managed by your doctor. During the tapering process, alternative treatments such as H2 blockers, another type of acid reducer, antacids, and lifestyle modifications like dietary changes and weight management can help manage symptoms. So talk to your doctor about the best way to manage your heartburn or GERD. Also discuss with your doctor about supplements if you're on long-term PPIs or if you cannot avoid taking it. And lastly, eat a balanced diet rich in vitamins and minerals. Avoid large meals, especially when close to bedtime. Try to stay upright and avoid lying down after a meal. You can help manage GERD and support your overall well-being. Remember, a healthy gut means a happy you. Thank you for joining. See you next time.